We're in Taipei's Xinyi district taking a quick look at Taiwan's gold standard COVID-19 response. Taiwan is a country of nearly 24 million people located about 130 kilometers away from China. As of March 16th, Taiwan has 67 confirmed COVID-19 cases, while other countries nearby have hundreds or tens of thousands of COVID-19 cases. We'll take a quick look at the timeline and actions that Taiwan's people and government took to prevent a widespread community outbreak in a very urban and densely populated country. So these steps are going to have lessons in many other places around the world. On December 31st, Wuhan's public health officials announced publicly for the very first time that they had several patients with an unidentified type of pneumonia. On that very same day at 9 a.m., Taiwan's top elected officials had a high-level meeting deciding to increase screenings of incoming passengers at the airport for any flu-like symptoms and then question them about their travel history and contacts. In addition, any flight from Wuhan had to undergo every single passenger having a health screening before they were allowed to deplane and get out of the airport. Having doctors in positions of power and Taiwan's extensive protocols implemented after the 2003 SARS epidemic really made the government response in Taiwan much faster and decisive than many other countries. Taiwan's Vice President, Chen Chien-jen, is a Johns Hopkins-trained epidemiologist. Taiwan's Vice Premier, Chen Si-mai, has a master's degree in public health from National Taiwan University. And there are many other political leaders in Taiwan that are former doctors or have public health backgrounds. On January 15th, Taiwan's government categorized the virus as a Category 5 communicable disease, which allowed the government extra powers to enforce quarantines on people that had COVID-19 symptoms or tested positive. On January 20th, Taiwan's Center for Disease Control launched the Central Epidemic Command Center. The Command Center has daily press briefings that announce new COVID-19 cases, how the cases happened, and also new travel restrictions and warnings based on the latest information available. As of March 16th, the Central Epidemic Command Center received over 400,000 consultation calls, held 72 press briefings, posted 1,600 social media posts, and aired ads on over 221 TV channels. Over a 5-week period, the Central Epidemic Command Center launched over 120 measures related to case identification, quarantine procedures, and border control to help safeguard public health. If a country is categorized as level 3 for COVID-19, then any arrivals from those countries have to go into a mandatory 14-day quarantine. The quarantine is enforced by random public health visits from authorities, a $32,000 fine, a potential fine for breaking quarantine, and mobile tracking apps. Rigorous contact tracing is done for all confirmed cases of COVID-19. If a confirmed COVID-19 case traveled through a difficult to contact trace area, such as a crowded tourist spot or an MRT station, the government releases the exact times that the case was in different areas, and then people can then check if they were in the area at the same time and manage their health for a period of 14 days and report any symptoms via 24/7 hotline 1922. From January to today, here are some things that the government and people did together to help prevent community transmission. All large events have been canceled or postponed. Office buildings, restaurants, department stores, malls all conduct temperature checks and hand sanitization at the entrances. School was postponed for 2 weeks, and when school resumed, there are temperature checks and hand sanitizer stations at the entrances of the schools. All students, staff, and teachers have to wear surgical masks, which help prevent the spread of COVID-19 from asymptomatic carriers. Surgical mask exports were banned. Production increased to 10 million masks a day with the help of the military and a partnership with the private sector. And lastly, distribution of masks was taken over by the government, and any masks that are left over after distribution to medical professionals and vulnerable populations is sold through a rationing system via the pharmacies or online. So you show your health insurance card and you can get your mask allotment every week via your health insurance card, and you pay a tiny fee for those surgical masks. On Taipei Metro, there are videos playing all the stations and platforms showing best hygiene procedures. It also features the mayor of Taipei riding the metro, explaining the best practices for maintaining public hygiene and showing his confidence in our transportation systems to weather the storm. The Airport Express has temperature checks. And there's also a special taxi cab system for high-risk people that came from areas with many cases of COVID-19, so they can use that to get around safely. Hand sanitizer production has been increased dramatically. National Immigration Agency records and National Health Insurance records have been combined. So when a doctor scans someone's health insurance card, they can see if they went to high-risk areas. And also, in all previous testing of flu-like conditions that tested negative for different strains of flu, they were called in back to the doctor's office to test for COVID-19 based on the risk profile of locations they have traveled. So combining these health insurance records with the national immigration records really helped in the government being proactive and asking folks to get themselves tested. These are just some of the measures taken by the Taiwan government and people to safeguard public health. Some of these measures will be easier or harder to replicate based on your health insurance system in your country and other factors. But it goes to show that even in a vibrant democracy with a free press, that an effective pandemic response can be made if the right steps are taken and the public helps and listens to their public health authorities. Thank you so much for watching, and please listen to your public health authorities as the situation unfolds in your community. And if you want to learn more about Taiwan's COVID-19 response, go to cdc.gov.tw/en for the English version of Taiwan's Central Disease Control website.